Are you having shoulder pain when lifting your arm or reaching overhead? Are you unable to perform pressing movements in the gym due to pain in the front of your shoulder? Are you having trouble with moving heavy things around your house or just being able to lift things up that commonly don't cause you issues? My name's Tyler McGachy from Warrior Sports Physical Therapy, and today we're going to discuss a little bit about your shoulder joint and what could potentially be causing that pain and limiting you from doing the things that you love to do. Your shoulder joint is made up of 3 different bones that comprise 2 different joints within your shoulder. The 3 bones that consist of your shoulder joint are the clavicle or collarbone, the humerus or upper arm bone, and then the shoulder blade or scapula. The functional purpose of your shoulder joint is to be able to position your arm and hand and perform everyday activities and functional tasks in a very specific and very smooth way. There are 2 main joints of the shoulder. The acromioclavicular or AC joint. This is the joint that connects your shoulder blade and your clavicle together. And then your glenohumeral joint, which connects the upper rounded part of your humerus or upper arm to your shoulder blade joint. The shoulder joint is a ball and socket joint, meaning that there is a rounded, again, upper portion of the upper arm that moves inside of a concave or rounded out part of your shoulder blade to create mobility. The shoulder joint has the greatest range of motion of any joint in your body. And because of that, again, it is very, very mobile. But due to a lack of passive stability from supporting structures, it typically will have a higher injury risk due to the lack of stability within the joint. There are many supporting structures within your shoulder joint, the first being many ligaments and tendons that run through that small space. Ligaments are structures that connect bone to bone, whereas tendons are structures that connect muscle to bone. And again, within our shoulder, we have numerous different ligaments and tendons that help to provide stability and mobility within the joint. There are also many different muscles that act on our shoulder joint, with the main stabilizers of the joint being the 4 rotator cuff muscles. These are small muscles that work to functionally and dynamically stabilize the inside of the joint when we perform movements by wrapping around the top part of the upper arm. Other larger muscle groups that work to act and provide stability at the shoulder are your deltoids, your pectoral muscles, your lat muscles, and your trapezius muscles. The last supporting structure to your shoulder joint, major supporting structure, is a piece of cartilage called your labrum. Your labrum acts as a suctioning force around the upper rounded part of your arm in order to provide some passive stability to the joint. Most common injuries that we see at the shoulder joint include shoulder joint sprains that can be of both the AC joint and of the glenohumeral joint, dislocated shoulders, osteoarthritis, bursitis, tendinitis or tendinopathies, which are pain and inflammation of the tendons of the shoulder joint, shoulder fractures, and then also labral tears, which are common from also shoulder dislocations and then in overuse repetitive injuries such as pitching as well. A couple of do's or don'ts when it comes to your shoulder joint. Do make sure that you maintain a proper diet and that you're performing a proper warm-up prior to your exercise utilizing the RAMP method. Also, make sure that you're participating in regular exercise each day as recommended by the American Heart Association, which is 150 minutes of moderate intensity exercise per week and at least 2 days of strength training to your shoulder per week. A couple of don'ts when it comes to your shoulder. Do not continue to push through and perform similar activities if you're having consistent or increasing pain levels within your shoulder. And do not ignore symptoms such as swelling, extremely stiff muscles, skin discoloration or bruising, painful clicking or popping, limited range of motion, pain with movement, or being unable to use your arm as you normally would throughout the day. If you're having issues or continual pain with the joint that we discussed today, if you've tried fixing this on your own or you've seen another healthcare provider and tried other treatments that just aren't working, feel free to take a look at our website and schedule an evaluation with us today so that we can take a deep look into what is causing your pain, figure out what the root cause of that is, and then get you on a plan and a road to recovery going forward. Again, this is Dr. Tyler McGachy from Warrior Sports Physical Therapy. Thanks for listening and stay tuned for future content about other body joints and what may be causing aches and pains in those as well.